Now, you don't need to use that minoxidil after your hair transplant. Did you hear what I said? Stop using minoxidil after your hair transplant. Now, if you're coming across this video and you're about to go for a hair transplant and you're wondering, when can I restart my minoxidil after my hair transplant? This video is for you. So sit right here. And if you're coming across my voice for the first time, my name is Dr. Chefu. I'm the lead hair transplant surgeon at Avila Hair Restoration. I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. One common complaint I get from my clients, especially after a hair transplant, after they start using their minoxidil, they always say, my scalp burns. I'm like, okay, when did you start using your minoxidil after your hair transplant? Did you read your post-op instructions? Now, this is the time for me to go ahead, sit down, and talk to them all over again. The reason why they shouldn't use minoxidil after your hair transplant. So if this is you, you're hearing for the first time, Dr. Chaffee is saying, don't use minoxidil after your hair transplant. And here's the reason why I'm telling you not to use minoxidil after your hair transplant. Now, the issue is not using minoxidil. The issue is, how are you using it? When are you using it? The proper way to use it, that is the correct question that I need to ask you if you're complaining about itching or burning when it comes to minoxidil use after your hair transplant. So I need you to sit right here, watch this video to the end, and this might apply to you, especially if you're thinking about a hair transplant. Now, one thing I always say, if you're dealing with hair loss, you don't know what to do, you're thinking about a hair transplant, and you don't know your options, what kind of hair transplant you are going to benefit from. Now, one recommendation I always say is make an appointment with us. We offer free virtual consultations. Somebody from my team will get in touch with you, talk to you, find out how we can help you, and you go from there. Now, here are 5 things you need to know, especially if you're trying to start back your minoxidil. It's very important you understand that you cannot apply anything to your scalp after your hair transplant, immediately after your hair transplant is a no-no. This is not just the minoxidil. For any other hair products you cannot apply to your scalp after your hair transplant. You are actually given a specific hair serum or hairspray or something that you can apply to your scalp, especially to the area that has the hair transplant. And the reason why I say that why you cannot apply minoxidil after your hair transplant is because the first couple of days, your scalp skin is still healing. You cannot apply minoxidil because it's going to cause some burning sensation, irritation, and you don't want to do that to your scalp because you want to avoid dislodging your grafts or anything that's going to cause your grafts not to grow. Not just minoxidil, any other hair products. So it's actually written in our post-op instructions specifically not to apply minoxidil on your scalp till after a couple of weeks. And now the next point why you shouldn't apply minoxidil. Minoxidil can contain some type of alcohol, which is propyl glycol, and that can cause dryness, flakiness of your scalp, irritation. And what I tend to say is that when you have that flakiness, some people tend to pick at it. And once they pick at it, especially in the transplanted area, you have high chances of picking out those grafts that are still trying to grow. So definitely no minoxidil. I don't recommend you applying minoxidil, topical minoxidil, after your hair transplant. So you have to wait for a couple of weeks before use of your or reintroduction of your minoxidil. Now, timing matters when it comes to application of minoxidil. Like I already told you, you can apply minoxidil a couple of weeks after your hair transplant. Now, the next question is, when can I apply my minoxidil? My recommendation, 30 days after your hair transplant, you can reintroduce your minoxidil. Some hair surgeons can tell you 2 weeks, but to be on the safe side, I would say 30 days. So what I tend to do is that I place my patients on oral minoxidil before the hair transplant so that we can avoid use of topical minoxidil after the hair transplant. So that is actually the best way to avoid the side effects after your hair transplant. So ask your hair transplant surgeon, what is the plan? Can I start oral minoxidil instead of topical minoxidil? And if it's burning, if you've had your hair transplant and your scalp is burning, it's itching, stop that minoxidil. That might be the culprit. But now, If you've tried oral minoxidil and you cannot tolerate oral minoxidil, you're having more side effects to the oral minoxidil. Now, your hair transplant surgeon can give you a formulation of minoxidil that doesn't have those drying agents in it. Foam minoxidil is also good, but you need to talk to your hair transplant surgeon. You talk to your primary care doctor, but most especially your hair transplant surgeon. We can give you a formulation that doesn't contain those alcohols that cause the drying, the flakiness, the irritation that comes with use of minoxidil. But still, you have to understand timing is important, type of formulation is important, and how to use it is very important when it comes to minoxidil. And finally, avoid use of multiple hair products after your hair transplant, especially if you're trying to reintroduce use of minoxidil. If you want to start using your minoxidil after your hair transplant, what I always say is that you need to start your minoxidil first, just the minoxidil. If you're having any burning sensation, irritation, you stop it. Because what I tend to see is that when you use multiple hair products, you don't really know which one is causing the problem. So my recommendation is after a couple of weeks after your hair transplant procedure, start your minoxidil first. Use it for a couple of days and see how you feel or how your scalp is taking it. And then you can start using other hair products in addition to your minoxidil. But if you're having irritation with the minoxidil, now you know it's the minoxidil that's causing the irritation and the burning, so you have to stop it. And I've told you other options, or the oral minoxidil, or they can change the formulation of your minoxidil. Now, if this video has helped you, you've loved this video, I'm sure you're going to love every other of my video on YouTube. YouTube name is Dr. Chefu. I teach you simple tips and tricks when it comes to making the right decision when it comes to hair transplant before and after your hair transplant and hair regrowth in general. Now, if you know someone dealing with hair loss and they've been disturbing you, bugging you, telling you, I don't like how my hair looks, I think I need to do something else, or they're thinking about a hair transplant, I only have one suggestion. We offer free virtual consultation. Go ahead and make the appointment for them or send them these videos and they can make an appointment for themselves. I promise you, you will save them a whole lot of stress. And till next time, take care of yourself, stay safe, bye-bye.